Welcome to the presentation Assisting Emotionally Distressed Students from the UW Oshkosh Counseling Center. Reflect on some of your past experiences with distressed students. How did you know they were distressed? What signs did they show? Most students will be emotionally distressed from time to time, but there are varying degrees of severity. Some distress is normal. When the degree of distress becomes so much that it interferes with academics, health, safety, and or their relationships, assistance is needed. Let's go through some signs that a student may be distressed. You might notice some nervousness or agitation, increased irritability, undue aggressive or abrasive behavior, some excessive procrastination, poorly prepared work, infrequent class attendance, little or no work completed. You may see signs of depression and a lack of energy, marked change in their personal hygiene, withdrawing from others, some fearfulness. You may see some dependency, a student who hangs around you or makes excessive appointments to see you, some indecisiveness, confusion, or bizarre, alarming, or dangerous behaviors. We're going to go through some of the general characteristics of students that may be experiencing distress. Problems with academic performance, a significant change in their academic status, any unusual behavior, significant change in relationships, references to suicide or homicide, or other common stressors, and those could be a loss of a job, upcoming final exams, a death, severe illness or injury, a parent's divorce, or loss of a role or position, such as no longer being a member of a team or president of their student organization, or just to name a few. Because you come in frequent contact with many students, you're in an excellent position to observe students, identify those who are in distress, and offer assistance. Your care, concern, and assistance will often be enough to help the student. At other times, you can play a critical role in referring a student for appropriate assistance and in motivating them to seek such help. Here are a few guidelines for responding to distressed or distressing students. Observe by noticing how the student's behaving, how they appear, what are they saying verbally and non-verbally by expressions on their face, body position, and activity. Initiate contact privately, in person, or through a private message through some electronic means. You can let them know of your concern by telling them why you're checking in with them, such as, I'm wondering how you're doing. I noticed that you've appeared really tired in class lately. Don't ignore strange, inappropriate, or unusual behavior. Early feedback, intervention, and/or referral can prevent more serious problems from developing. Clarify your role. You may not be the person best to help with whatever the issue or issues may be, but can help to connect them with that help or resource. You might say, as your professor, I may not be the best person to help you with what you're experiencing, but I can likely help you to connect with someone who can. If it appears that the student may have experienced something traumatic or deeply personal, you should let them know that if they share with you that they've experienced any act of violence, you would have to report that to the Title IX coordinator for an investigation for safety. However, you can help to connect them with a counselor at the counseling center or the Sexual and Interpersonal Violence Prevention Coordinator if they'd prefer to talk more confidentially. If they would like to talk with these resources, you should give the student their contact information and offer to sit with them as they make the call or send the email just to get connected if they would like. Listen objectively. Try not to get caught up in any emotions that may come up for you or assume that you know what they're experiencing because you've experienced something similar. Ask questions for clarification or rephrase what you heard them say to show that you're listening and care to understand. Offer support and assistance. Let them know that you appreciate them sharing with you and you're committed to providing them with assistance. Consider suggesting resources the student can access, such as friends, family, clergy, and professionals on campus. Know your limits. As a help giver, only go as far as your expertise, training, and resources allow. If you're uncertain about your ability to help a student, it's best to be honest about it. Trust your feelings when you think an individual's problem is more than you can or should handle. When a student needs more help than you're able or willing to provide, it's time to make a referral to a professional. Below are some signs to look for in your feelings that may suggest that assistance from a professional is warranted. You find yourself feeling responsible for the student. You feel pressure to solve their problems. You feel you're overextending yourself in helping the student. You feel stressed out by the student's issue or issues or behavior. You see a behavioral pattern repeating itself in your interaction with the student. You feel that the problems the student brings to you are more than you can handle. You feel anxious when the student approaches you. Let's explore some ways to respond to certain concerns, such as verbal aggression, violent or physically destructive, poor contact with reality, suspicious or paranoid, anxious, panicky, demanding, substance abuse, depressed, suicidal. For a student that's showing some verbal aggression or seems to be demanding, try acknowledging their anger and frustration. Like, I hear how angry you are. Try rephrasing what they're saying and identify their emotion. I can see how upset you are because you feel your rights are being violated. No one will listen. Allow them to ventilate, get the feelings out, and tell you what is upsetting them. Reduce stimulation. Invite the person to your office or other quiet place if this is comfortable and safe. Tell them that you're not willing to accept their verbally abusive behavior, such as, when you yell and scream at me that way, I find it hard or impossible to listen. Tell them that they are violating your personal space and to please move back if they're getting physically too close. You may say, please stand back, you're too close. Help the person problem solve and deal with the real issues when they become calmer. Set limits on the time and energy you're willing to spend with a student. If a student is being violent or physically destructive, try to prevent total frustration and helplessness by quickly and calmly acknowledging the intensity of the situation, such as, I can see you're really upset and really mean business and have some critical concerns on your mind. Explain clearly and directly what behaviors are acceptable, such as, you certainly have the right to be angry, but hitting, breaking things is not okay. Stay in an open area. Divert attention when all else fails. If you hit me, I can't be of help. Get necessary help. Other staff, university, police, student health center, counseling center. But if you feel this is an emergency, call 911 or ask someone directly to do so. Remember that student discipline is implemented by the Dean of Students' office. For a student that seems to be having some poor contact with reality, you may want to try some of these ideas. Respond with warmth and kindness but with firm reasoning. Remove extra stimulation in the environment and see them in a quiet atmosphere if you're comfortable doing so. Acknowledge your concerns and state that you can see they need help, such as, it seems very hard for you to integrate all these things that are happening, and I'm concerned about you. I'd like to help. Acknowledge the feelings or fears without supporting the misconceptions. Like, I understand you think they are trying to hurt you, and I know how real it seems to you, but I don't hear the voices. Reveal your difficulty in understanding them when appropriate, such as, I'm sorry, but I don't understand. Could you repeat that or say it in a different way? Focus on the here and now. Switch topics and divert the focus from the irrational to the irrational or the real. Here are some ideas for a student that seems suspicious or paranoid. Express compassion appropriate to your role. Be firm, steady, punctual, and consistent. Be specific and clear, and be aware that humor may be misinterpreted. Remember, suspicious students may have trouble with closeness, trust, and boundaries. Humor may not be seen as funny, it may be seen as rejection or aggression. Invite questions and offer availability for students to ask you their questions outside of class. Many students aren't comfortable sharing questions in front of others and have some social anxiety to one degree or another. If you believe that the student is distressed because they are substance abusing, watch for signs of drug or alcohol abuse. Those might be a preoccupation with drugs, inability to participate or focus in class activities, deteriorating performance in class, periods of memory loss or blackouts, sour breath, bloodshot eyes, poor hygiene, lack of focus, being fidgety are just some of those signs. Share your honest concern with the person, expressing your specific examples that you've noticed. Encourage them to get help and get necessary help in instances of intoxication. If you suspect that a student is depressed, let them know that you're aware that they seem to be feeling down and that you'd like to help. Reach out more than halfway and encourage the student to express how they're feeling. Initially, they might be reluctant to talk, yet others' attention can help the student to feel more worthwhile and valued. Tell the student of your concern and recommend counseling as a way to get more support. If you believe that a student is suicidal, take the student seriously. 80% of those who ended their life by suicide give warning of their intent. Acknowledge that a threat of or attempt at suicide is a plea for help. Be available to listen, to talk, to be concerned, but refer the student to the counseling center, the student health center, or other appropriate agency for professional help. If you feel the danger is imminent, call 911. Administer to yourself. Helping someone who is suicidal is hard, demanding, and draining work. We want you to keep in mind that your well-being matters too. Helping people in distress can create stress for the helper. In order to stay well, it's vitally important to consider these ideas. Respond to situations in a timely manner. If waiting means worrying, it's generally better to intervene. Your safety must come first. If you don't feel safe assisting directly, reach out to others who can help you. The student care team, university police, a supervisor, chair, dean, etc. are just some of those resources. Consider your own well-being. It's important to pay attention to how you're feeling and seek out what you need to care for yourself. The resources on the next slide are all options you can readily utilize for help and support. The Counseling Center, the Dean of Students Office and Accessibility Center, the Center for Academic Resources, the Student Health Center, University Police. These are just a few of the many resources available on our campus to assist you in assisting our students. Thank you for your interest in learning more ways to help our students in distress. And please don't hesitate to contact the Counseling Center with any questions or needs for more information.